You have to love what you do, and I love what I do. Either talking about survivorship or end-of-life issues. I'm there to help them, hopefully, either way, to get through that process. A lot of our patients, too, along the way, it becomes, I think, if it's a reality that they may not survive, they actually, I would say, majority of our patients have a comfort level with that because they come to the point where they're ready, the fight's gone out of them, and that's a good thing. And everybody is different, and some patients won't go there, and so you know how much you can talk to them about.
This past week, I had a young woman who had a balance, and it was overdue, and I had to approach her and ask her if she could handle that, and she said no, she couldn't. Her husband was out on disability, and she was out of work because she was ill. And one of the resources that we have at the hospital is different programs for reduced fees or free, what they call free care. And so I immediately went to the patient accounts department and got her the paperwork she needed and assured her that, you know, there is something that can be done. And I think sometimes they wonder if they can't pay, if treatment is going to be stopped. And that's absolutely not even an option.
We tell the patients that if they have, from the smallest concern to the biggest thing, any questions, call us. There's a number that, you know, they can call 24 hours a day, and we really want to be there. It's not just faces. You get to know people's names and people's families and what's going on in their life. You have the time to talk to them.
You know, it's funny that people say to us, is that a depressing place to work in oncology? Because I found it just the opposite. You know, we can't really understand totally what somebody's going through who has cancer, who gets that awful diagnosis. So you do the best you can to just make their day, or even the few minutes that they're with you, enjoyable. If we can make somebody smile, but they're, you know, I know that they're having an awful day and they're feeling miserable, and, you know, maybe they just got diagnosed and they're not real happy at this time. But if I can at least give them that smile and that little feeling of, then I think, you know, yes, they're better for it, but I think probably I benefit more than they do.
I am a surviving caregiver. My husband passed away about 2 months ago after a long, challenging, courageous journey for 3.5 years. He was very brave. He never said, "Why me?" He was very practical. I have agreed to be part of this video in order to have testimony to the fact that you still can live a full life even though you've been given this incredible challenge. And openness and involvement with other people and reaching out to other people for help, I found not only helped them, but it helped us. So indirectly, it may have been selfish to do that and to be so, I would guess, say public in our illness. We lived our life. We didn't spend time talking about it all the time or bemoaning it, and we vowed to each other we wouldn't do that. That whatever life we had left together, be that months or years, that we would live that as fully as we can, and we did. We traveled and we had wonderful family get-togethers and parties and quiet candlelight dinners, and we did it all.
My mother has passed away and she's no longer here with me physically, but she hasn't left my life because her legacy always remains inside of me. Cancer, while it took every knot, almost tore apart every knot that we had tied together the past 18 years of my life that I've known my family, while it pulled on every knot, it never broke it, it never pulled it apart. Cancer tried all of our patients numerous times. It tried us physically and emotionally, but yet some kind of glue held us together. I think the power of love and the power of one another, being there for each other, held us together and kept us close. I didn't want to open up and share with the whole world when I was at school or when I was taking classes. I wanted to live my other life, my life aside from the illness. I wanted to just be the student that goes and takes the classes. I don't know how scared I was, but there was a degree of being nervous and scared, and when I look back at it, I think it is a weakness that I didn't ask for help. I think I would have been a much stronger person if I had asked for help.
And there's a story in Pooh where he goes to visit his friend Rabbit, and he goes down the hole and he eats too much honey while he's visiting, and he ends up, when he goes to leave, he ends up getting stuck exiting the hole. And he describes the situation of being in this very, very tight space where he can't get out and he can't get back in the hole, and he just has to be in that tight, uncomfortable space until he can pass through to the other side. And his friends, they try to pull him and they try to push him, and they're not quite sure what to do, and there's one on the outside and there's one on the inside. In the end, what he says to them is, I just need you to sit with me in my tight, uncomfortable spot until I'm not tight and uncomfortable anymore. And it's a simple story, but I love that image. And I think it's a powerful image that what those of us who care for people, either as caregivers, as healthcare providers, or as loved ones, family and friends, what we're called to do when people are sick, when they're suffering, when they're facing huge challenges, is to be present with them, to sit with them in that tight and uncomfortable spot. And sometimes that means being silent, sometimes it means holding their hand or hugging them, sometimes it means providing rides or meals or other kinds of physical, tangible support. But I think a lot of what we offer is a lot less tangible than the ride or the meal. It's a kind of love, it's a kind of safety net that we remind people is always there underneath them, and that if they fall, we're going to be there to help catch them and to help pick them back up again, even though we can't make the cancer go away, and even though we can't take away the fear or the anxiety, we can still be present.